Hi, my name is Charlotte. I'll be the student nurse that is going to be working with you, and at the moment I will be inserting a catheter. A few questions for you. Can you verify your name and date of birth for me? Thank you. Have you had any problems urinating or feeling the urge to go and cannot go? Okay, so just a few things to clarify for you. A catheter is inserted if there's an ability to void, if we're monitoring eyes and nose and the patient is incontinent, and for bladder decompression. Also, the difference between a straight cath and an indwelling catheter is a straight cath, a CNA can do. It goes in, drains the bladder, and it comes back out. The indwelling catheter only a nurse can do, and it stays in until it's ordered to come out. As surgical aspects that are needed to know is sterile objects remain sterile when it touches another sterile object. Only sterile objects can be placed in a sterile field. Sterile objects or field out of sight or below the waist are considered contaminated. Sterile objects in field are contaminated if they are exposed to air for so long. It is considered contaminated if the sterile surface becomes wet and fluid flows in the direction of gravity, and the edges of the sterile field or container are considered contaminated. So I would bring in extra gloves and catheters just in case the gloves don't fit or there's a hole. And then catheters I would bring in just in case, if for a female it goes into the vagina instead of the bladder. I will make sure the lighting is good in the room. I will work on the right side of the bed because I am right-handed, and that will be the hand that I will be using to insert the catheter. I will have the patient lay on her back. If it's a female, I will have her bend her knees and open her legs as wide as she can. If the patient is confused or agitated, I will have help from other workers. I will wash my hands completely. Make sure that the patient's top half is not exposed and only the area that I need is. I will provide peri-care to begin with just in case the patient had BM or urine on them, just so that it's not going into the patient's bladder to cause an infection. While doing peri-care, I would locate the urinary opening. I would also make sure I had the trash can near, just so that I don't have to reach across or anything does not become contaminated. I would open the catheter kit and organize everything the way that I needed to go. I would set up my sterile field and put on my gloves. Organize the equipment in the order that I needed to go in. I will put the gel on the Foley just so that it's prepared and I don't have to wait till the last minute to do. I would clean the urinary meatus with the betadine. I will start from the opening outward Use one stroke per brush. And then I would do the furthest side first, just so that I'm not contaminating the side that's already clean, and then one straight down the middle. I would let them know that the patient know that it may be uncomfortable when inserting. If I feel resistance, I would twist the catheter a little bit and apply a little bit of pressure, not too much that it's hurting the patient. I would inflate the balloon with usually 10 milliliters of sterile water. Once I know it's inserted, I would tug the catheter gently just to make sure that it's in place. Secure it with the anchor that is provided in a kit. Make sure that when it is inserted that you are getting urine out. I would again do pericare to make sure that all the betadine is cleaned up and nothing was spilled, and then I would take the gloves off. Next, I would document the accurate insert and time and date, report the output that was discarded before inserting the catheter or while putting it in, the type and size of catheter, and then any findings during the procedure or what the patient report as far as pain or discomfort. While taking the catheter out, we'll make sure that the orders are in, that the patient meets the appropriate requirements for removing the catheter, and then visualize the insertion site and if there's anything unusual that you see. I will identify the patient, explain the procedure. I'm Charlotte. I'll be taking out your Foley catheter. Position the patient in a comfortable way. Make sure that I have a syringe that will be able to take out 10 milliliters of water. And if it's more, I would have one that is able to take out 30 milliliters of water just to make sure it's all out. I will wash my hands completely, provide privacy for the patient, put on my gloves, remove the anchor, position a patient that they're on their back. If it's a female, again, have them bend their knees and spread their legs as wide as they can. Insert the syringe to deflate the balloon and pull it back. Just give it a little tug and gravity should take out the water itself. Once it gets to around the 10 milliliters, I would give it another tug just so that I know that all the water is out. While taking the Foley out, I would wrap it around my fingers just so that the urine does not go everywhere. Make sure that I have all pieces of the catheter out and make sure nothing is left behind. I would take off my gloves, and then I would document the removal time and date, the amount of output that was in the Foley, the type of catheter size, any findings during the procedure, if there's any blood or anything unusual, the patient report, and I would also let the patient know that now that the Foley is out, we do need to still monitor your eyes and nose. So if you're able to, if it's a male, give them a urinal, or if it's a female, put a hat in the toilet so that you get the right amount. And after that, you may have to do a bladder scan just to make sure that the patient is getting everything out. Do you have any questions? Thank you. Have a good day.